the executive director of SARA. That is the South Alamo Regional Alliance for the Homeless. How are you, Katie?
I'm doing well, thank you. How are you?
I'm doing fantastic. Thank you for taking time out for us today.
Absolutely, very excited.
So now, you are really, I mean, you've not been on the job here as executive director of SARA for maybe a month?
Yes, about a month now. It's gone by fast.
So tell me tell us a little bit about Sarah. A lot of people don't know about Sarah. Tell us about Sarah.
Sure. Well, Sarah's been around now for about 5 years, and I actually worked with Sarah before getting promoted to executive director. I was the second employee hired in 2015. And Sarah is an agency that doesn't provide direct services, but what we do is work with all of the other agencies to strengthen our continuum of care to provide services to people experiencing homelessness. So we work on coordination, measuring outcomes, and looking at how we can better target resources to people in need of help. And we're really focused on lasting and sustainable system-wide strategies and improvement. So that's the type of work that we do at SARA.
And important work that is. So since you've been there, since you've just, you've been there since 2015. So, so what initiatives are you going to bring that's going to make it Sarah even more effective?
Sure. Well, a couple of our past successes. One was the work that we did in partnership with the city and county, USAA, and a couple of other key partners to really make improvements with veteran homelessness. When we started, there were about 1,000 veterans experiencing homelessness at any given time. Through kind of a collaborative and concerted effort of targeting resources and sharing information with each other, we were able to house hundreds of veterans in just 2 months, and now
wow,
continue to monitor our progress. And that number has stayed around 200 at any given time, but we have plans to move every veteran into housing within 90 days, and we've maintained that for several years. We also, one of our bigger initiatives was the youth movement to end youth homelessness, and we got a large grant from HUD to be a demonstration community. And so it's really taking those lessons of, building a collaborative partnership, setting some goals across sectors, and we'd like to continue to take that model and make progress in other areas.
Well, I really, really seriously applaud you for that, because San Antonio, I love San Antonio. One of the things I love about San Antonio are all of the wonderful nonprofits. From a state perspective, Texas really doesn't do much to help, out. You got to make it on your own, or you have to have somebody help you. But in San Antonio, we're really blessed because there's so many people like yourself who are giving. And so to be in a role where you are to provide coordination efforts, that is really needed. So that is awesome that you are doing that and having the success that you guys are.
Absolutely. And it's our partners that provide the direct service that do the hardest work, day in and day out. Their commitment is just incredible. We're really here just to help connect the dots between agencies, provide some coordination, but the work that they do is really incredible.
Absolutely, I would agree with you. So now, one of the things that I'm a big believer in everybody deserves to live with dignity. And so I provided, did feeding under the bridge for, 20 years. I've done that. I've been out there on Saturdays, and I've been feeding homeless people for at least 20 years. The different places around out in the community. And one of the things that really bothers me with the changes that we see happening in our city, especially on the south and east sides, it's great to see those neighborhoods become revitalized and things, so to speak. But what hurts more is that it just seems that we continue to push our homeless people around like they're deer in the way of a road or something. And what do you guys? How do you approach something like that?
Yeah, well, a few things. I do think there's work to do in the community around how we frame and view homelessness. That's something we really want to get the message out about. And I think the pandemic this year has really shown the broader community that all of us can find ourselves in a vulnerable position. And so hopefully that makes it more relatable for people that don't have the experience. But I'll also say that, facing this challenge of COVID-19 this year, it highlighted and exacerbated some issues that already existed. And even though it's been challenging, especially for our partners and, people out there to access services, there's been a lot of innovation and people coming together to quickly address things in an unprecedented way. So just one example is the city of San Antonio is now hiring an outreach manager and a whole outreach team that's just focused on providing services. When we did an analysis a few years ago, there was only one outreach worker for every 150 or so people.
Oh my gosh.
And so when you think about that, building a meaningful relationship is incredibly difficult. So hopefully by having more capacity there and more patience and, services, building those relationships is really key so that somebody, has that trust and is then willing to access shelter or move straight into housing with a case manager. That's another option. So I'm encouraged by that, and I hope the community will see a huge impact next year once that whole team is on board.
And so you guys will be working with them as far as helping them with their focus their efforts, so to speak?
Yes. So in the coordination role, we'll help facilitate a working group, a case conferencing every couple of weeks. So all the different outreach workers are communicating about their caseload and, if they're running into any challenges accessing services, they have that communication point. And then we'll also host a strategy group that's focused on the bigger system issues. If people are having issues getting into mental health treatment or coming out of hospitals, discharge planning, more at that kind of system level. So that's how we'll help, is by helping to facilitate those groups and conversations.
Thank you for sharing that. So another question I have here, and I don't know if this really applies, so if it doesn't, please tell me. So do you guys have a role in the policing reform? We've talked about, I've heard the mayor talk about not having police respond to every call when really a mental health worker might be better suited. And some of those calls, a lot of those calls are around homeless people or people with mental illness or people who don't have stable housing. And so do you guys get involved in that at all?
We have noticed that, SAPD is sometimes having to fill a gap that could be served by, like you said, a mental health worker. We'll also have these street outreach workers that'll be available and on call. So I think that'll be a positive change. Although I will say we have partnered in the past with SAPD just specifically on their ID recovery program.
Okay.
Which has been really helpful. And those are the officers who are in, regular clothes, just meeting downtown to help provide IDs because they discovered a process where they could really expedite getting an ID. And I do think they're also looking at community members who could eventually take over that program.
Awesome. All right. So now, one of the things I've been wanting to ask you about, because that's when I first saw Neil sent me this press release. Tell me about the partnership that you have with the housing development with I don't remember all of the partners, but is there, well, let me ask the question. Are you guys involved with a new housing project for homeless folks here in the city?
Yes, the Youth Housing Initiative.
Yes.
Yeah, so last year, Sarah, in partnership with our Youth Action Board, which is a group of youth and young adults who have experienced homelessness, and with some of our kind of key youth partners, we applied for a grant with HUD to be a demonstration program community. And basically, it's a grant you get by demonstrating you have a strong infrastructure and partnerships in place that you could do something innovative if you were awarded the grant. And so we were awarded the grant. It was the largest in the nation. It was $6.8 million. And we went through a community planning process to talk about what would it take to prevent and end youth and young adult homelessness. And so that's up to age 25.
Okay.
So once we developed that plan, our Youth Action Board provided input on what type of services they'd like to see, which has been really meaningful and helpful, I think, for everyone to focus on hearing directly from the people who have gone through the services and housing programs.
Uh-huh.
So now, locally, we issued some of the first round of funds to to Endeavors, Providence Place, Roy Moss Youth Alternatives, Thrive Youth Center, and also UTSA. They're doing a new former foster care youth housing program.
Wow.
It's really incredible. They're all just getting started, but we're incredibly excited, and we really want to build awareness and a movement around this effort in San Antonio, because we've also heard from our youth and young adults that it's hard to know where to access the services and have kind of a centralized place where you can get all of the information you need. So that's something we're really working on as well.
Awesome. I'm a big fan of Roy Moss. I was on their board for about 10 years, so big fan of them. Yeah, they're an outstanding. Well, all of the organizations you just enumerated are outstanding organizations. Well, I was so excited to see that, because I just really hate that people have to go homeless. But when you see a child or youth out there, they really don't have hope, and they look lost, and it's just heart wrenching. So I was really pleased to see that. So this 6.8 million, how long do you have to spend that?
So it's a 2-year grant, and then after the demonstration period, we'll continue to monitor and renew programming into the future. So it's renewable funding for the community.
Awesome.
Which is amazing.
And that is amazing. So now, will these be for actual new homes, or are they funding existing homes?
So it's not for housing development, but it's for rental assistance programs.
Okay.
Where there's a case manager. So
Okay.
it's rapid rehousing so that people can move into housing and have follow-up case management to get stable. And then we also funded mobile outreach with Roy Moss. So
Okay.
with another funding source, we kind of brought 2 partners together with their county and this fund, and they're going to have a mobile unit that goes out into the field and to provide services where people are, which is exciting.
That is very exciting. That is sorely needed. I mean, and and we used to have another organization I was a part of for a long time, the Community Clinic, and it was an independent community health provider, and we did all kinds of treatment for different whatever it was, whether it was STDs or drug abuse or whatever. But we had 8 vehicles we used to go around, and we basically, we were basically mobile caseworkers, or so to speak. But that got absorbed by another healthcare provider, and they canceled those services. So I was glad to see that. That's good to hear. So what are your plans for the future? I mean, you've got a lot of exciting things going on here. You've had a lot of success. I'm really glad you are in charge, and I know Sarah's in good hands. But what can we look forward in the future?
Thank you. So right now we're focused on our youth movement and building awareness around that initiative. We're also working closely with our partners to prepare for the possible end of the eviction moratorium ending in early 2021. So we've been working with our partners to see how can we coordinate better, be ready, advertise in a clear way to the community so they can navigate easily if they're in need of rental assistance.
Mm-hmm.
So we've still been very much focused on the impacts of COVID-19. Now into the future, one of our other programs is operating a system called HomeLink, and it's basically a common assessment that all of our different partners do, so that no matter where you go seeking services, you find out what you qualify for, and you're added to a wait list if necessary for lots of different programs, not for just the program that you've approached.
Wow.
So we really also want to build awareness about that. We have about 20 different HomeLink partners, and we're still developing the system and kind of preparing for the impact of COVID-19. But hopefully, our vision is that eventually anyone in the community that needs to refer a friend, a family member, just anyone you run into that needs housing, it'd be really clear where to go to get connected to all of the resources.
Wow, that is quite a challenge.
It is. It's a lot of coordination and keeping up with our partners and constantly refining and making sure things are working well. And it's also critical that we continue to get input from people who are accessing services and moving into housing, because that's where we really learned the most. Besides looking at the data, it's hearing firsthand if things are easy to navigate, what the challenges are. So that's another area that we'll continue to focus on, that we've really been inspired by our youth action board, and we want to grow and continue to, get that input. And I think it's empowering when people can be part of the solution too, and helping other people.
And that is where so many assistance programs miss the mark. They are well intended. They want to do the right thing, but they don't reach out to the people who are receiving the services or beneficiary of the services to get their input as far as what they really need and how it should be delivered. So once again, another applause to you and your efforts. So if people want to, do you have an annual event coming up? You got a big Zoom party happening? Do you have a big fundraiser or any of those kind of things going on that you want to let the community know about?
Great question. So every year in January, we have a point in time count. And in the past, it's been a huge volunteer event where we send teams out into the community to survey and check in on everyone experiencing homelessness. We hand out goodie bags and connect with people, transport them to shelters if they're interested. We're still kind of finalizing what our plan is going to look like for this year. It'll likely be a different event, to ensure everyone's safety, but we'll be sure to share more information, but that's occurring at the end of January.
I'm a minute over my time. I have one more thing that you just brought to mind. Do you mind if I ask you?
Sure.
Oh, great. So, excuse me. The vaccines. How are you guys working on some type of delivery method or plan or coordinating vaccines for homeless?
That's a really good question. The city and Metro Health is hosting a vaccine committee that's focused on vulnerable populations, and we're attending. There's only been one meeting, I believe, so far, but we plan to be there to ensure we come up with a distribution plan when they're available. So I don't have the details yet, but that is something that's being worked on.
Well, when you do, if you want to come out and get the word out, please, I'd love to have you back on the show to discuss that. And I know I can count on you for this. Make sure that our homeless people get their fair share of vaccines. Don't let them get left behind.
Absolutely. And yes, as soon as I have that information, I will contact you.
Well, Katie Vela, Executive Director, Sarah, she's doing a fantastic job. Real quick, how do people make a donation if they want to make a donation?
They can visit our website at www.sarahhomeless.org.
Awesome. Go to that, www.sarahhomeless.org. And,
Sarahhomeless.org. Oh, sorry.
and so please go there. Please, even though they got $6.8 million, they need more. You know how these organizations are. They are running on a shoestring. They're very efficient. So all of your contributions will go to great use. Katie, thank you so much. I really appreciate you letting me take a couple extra minutes today. You are a wonderful person. May God bless you. And you and your staff stay safe.
Thank you so much. I appreciate it.
And besides, I'll make sure that you get a copy of the video.
Okay. Thank you.
Thank you. Katie Vela, Executive Director of SARA, which is the South Alamo Regional Alliance for Homeless. Great interview, great person, great organization. KRV FM, the heart and soul of San Antonio. You're the Dr. Doug Saturday Insight Show. Coming up next is going to be San Antonio's own Wendy B, a.k.a. Wednesday Ball, a.k.a. Wendy B. She'll be back in about 10 more minutes. KRV FM, the heart and soul of San Antonio. Dr. Doug Show on a Saturday. We will be back in just a moment.